Good morning, everybody. Morning. For those in the back, maybe take your seats and we'll get started. I just want to welcome everybody. It's just such a delight to have everyone here at the Bloomberg Center here on Earth Day. I'm Dan Polsky, Bloomberg Distinguished Professor of Health Economics and Policy and Director of the Hopkins Business of Health Initiative. The Hopkins Business of Health Initiative, we like to call it HBHI, integrates the scholarship across Johns Hopkins University around a shared vision of a healthier America. We do this within and across our partner schools, the Carey Business School, the Bloomberg School of Public Health, the School of Medicine, and the School of Nursing. In pursuit of this vision, our work focuses on the role of business and incentives through rigorous, objective, nonpartisan, interdisciplinary research. We're very excited here today to be hosting this special event on Earth Day. Earth Day is a day dedicated to raising awareness of the importance of long-term ecological sustainability. Today, we seek to raise this awareness from the perspective of the health sector. Our focus, consistent with the focus of HBHI, will be addressing the healthcare sector's carbon footprint. We will start this event with a fireside chat and then continue with an expert panel. Our moderator for the fireside chat, Joanne Kennan. She's a renowned healthcare journalist who has brought national attention to this issue. She's a HBHI core faculty member, journalist in residence at the Johns Hopkins Schools of Public Health and Nursing, and a contributing editor of Politico. And of course, our honored guest, HBHI Becerra, the 25th Secretary of the Department of Health and Human Services, and the first Latino to hold the office in the history of the United States. We are very, very honored to have you with us.
So people often ask me how I learned so much about healthcare and public health, and I often tell them, if you spend as many years as I did on the Hill, listening to the Ways and Means Committee and the Senate Finance Committee, that, there's a lot of theater and there's a lot of politics. There's also a fair amount of substance, and that might be where you learned healthcare too, right? So thank you very much for joining us. Secretary Becerra has really made climate a signature issue. When I started writing about this last year, I was just astonished at how big a problem it is in healthcare. The healthcare sector is responsible for 8.5% of US emissions, and some people would tell you it's even higher. If healthcare globally was a country, it would be responsible for, I think the figure is, it would be the 5th largest emitter in the world, and the US is responsible for a fourth of that. It's also he established the Office of Climate and Health. It's also the environmental equity, climate equity. Yeah. So we're going to talk about both of those issues. We're talking about equity, and we're going to talk a little bit about how do you begin to decarbonize health, particularly in an era where it's hard to mandate things and everything is political. So the issue, you represented California in Congress for many years. Then you were the Attorney General of the state of California. The fires, mudslides, floods, all that's really become routine in California. How did you begin to sort of connect these environmental they seem to be just sort of one-off disasters, well, a series of one-off disasters, to really understand that this was something that is contributing to both acute and aggravating chronic disease? I mean, when and how did you make that connection, which is something that you've created at HHS as a priority?
And actually, I'll be honest with you, I didn't connect the dots until I was probably already in elected office in the state assembly in California back at the beginning of in the 1990s, and. But I began to see the connection. My father was a farm worker. After that, he went on to do a number of jobs, always manual labor, always outdoors. And in California, it can get very hot. He used to do a lot of paving of roads during the heyday of freeway construction in California, the 5 freeway, the 80. And if you've ever stood underneath asphalt when it's baking, when it's first being laid, on a day which is already 110 degrees, it can get very, very hot. And that's what he did a lot. He also did a lot of pipe digging and laying, I'm talking not little pipes, I'm talking 3-foot pipes. And outdoors, outdoors, outdoors. I got to work as a construction worker as well, like him, as a laborer, helped pay for college. And one day we were working on a bridge, and then I just happened to see a whole bunch of men gathering, and I asked one of my colleagues, what's going on? He said, I forget the gentleman's name. He said, just passed. And I said, what do you mean passed? Yeah, he just died. The heat exposure had taken him. He was an older construction worker, but it didn't, I thought to myself, oh, God, that's too bad. And you went back to work. You take my dad's experiences, and my dad he was already dark Latino, but he had a permanent tan on him. And you begin to put those things together. Then you hear about how many people die of heat exposure, smoke inhalation over the course of time, and it starts to add up. And that's when it came to me that, wait a minute, a lot of the folks I grew up with are dying a little bit sooner than others. And you start to get into it. Then, of course, when you find out that the sector that's supposed to keep us healthy is leading to close to 10% of the exposure to some of the worst chemicals and heating up the environment and the climate, then you knew you had to do something. So when we established the Office of Climate Change and Health Equity, it was having connected so many dots over so many years to do whatever we can. So today, it shouldn't surprise you that we're trying to work with NIOSH to see what we can do to provide better information to outdoor workers when it comes to heat exposure, to smoke inhalation, the things that today are happening even more than way back when I was working with my dad in construction back in the 1980s.
Yeah, I mean, like last summer, a lot of stories out of Arizona during that horrible heat wave of 120 degrees out, and you're in the field at noon.
Yeah.
Can you also address sort of all of us, the changes in climate affect all of our bodies, they affect all of our communities, and obviously they affect the entire planet. But some communities are harder hit. So can you sort of briefly explain sort of, why environmental justice is, how do we address that? Why do we have to address that? And the other population that's very affected is seniors, because in all sorts of ways, not just the heat, but they're if your electricity goes out and you're on, an oxygen machine, there are all these things that we don't even think about.
Well, in fact, and I haven't seen the numbers recently, but I'd be willing to wager that the number of people who die from some form of climate exposure, the cohort probably that's largest is seniors, because during heat waves, they don't have the air conditioning. During cold waves, they don't have good heating, can't afford to pay for heat, and they freeze. But I suspect they're neck and neck with folks who are actually outdoors working, who are exposed the way my dad was. It's fascinating that HHS has a chance to do a great deal, and the legislation that the president has made possible for us to now become law has given us far more money than we've had before. The Office of Climate Change and Health Equity essentially is saying to America, wake up. This is all of our concern. People are dying every day, and we can try to change that. When you see a farm worker picking crops, you'll not only notice that it's back-breaking work, but take a look at the gear that they're wearing. It's stuff from home, but what it is it's usually a broad-based hat, and if you look underneath, you're going to probably find they've got some form of cloth underneath that. Typically what that is, they wet the cloth before they go out onto the field. They soak it. They put that over their head, then they put the hat on. That's the way they keep the heat down in their bodies, because the actual cloth, the rag they put on their head is wet, and so it'll last for a while before it finally dries up because of the heat exposure.
How about, there is, as you just referenced, the Inflation Reduction Act has a huge amount of climate in it, more than a lot of people understand. And it gave, some of the things it does is provide resources for the health sector, including nonprofits that can't benefit from tax credits. They can actually get financial assistance. So as the next panel is going to go much more into the nitty gritty of changing the supply chain. I mean, you're not a materials engineer, but I mean, think about healthcare. Everything is thrown out, right? It's single use, disposable. Just if all of you have been in a patient, most of you have been in a healthcare setting. Everything that touches you and a lot of things that don't touch you end up getting thrown out. There's a huge amount of waste, and that's a big challenge of changing that. But could you talk about some of the tools that you can't mandate very much, right? I mean, we're in an era where in extreme partisanship, if you try to mandate something, you're in court for 10 years or getting impeached or whatever. So how do you make people want to do this? How can you use you as the HHS Secretary, the Climate Office, the tools that you have in the IRA? How do you make the early adopter become the norm? How do you create change agents? Because it's going to have to be voluntary.
Yeah, and you're right. We have very little authority to require anything. So we do two things. We reach out because these are essentially stakeholders who are all about making you and I healthier. And so it's tough to sort of make that your cause if you're at the same time throwing away a lot of trash that becomes part of what damages our environment and damages our health. So we've had a lot of actual voluntary support in moving forward when we put out the call to the healthcare sector to join us in trying to deal with climate. We had pretty good response, especially since they knew it was not going to be free. The second thing we do is what we usually do in government. We threw money at it. We put money on the table and said, if you join, here's what we can do. And this is where the president's efforts to actually get us real resources has been tremendous. We can, for example, support a project that puts arrays that help us collect solar energy that will benefit not just that healthcare facility, but a neighboring residential area. Talk to the folks at, I think it's Boston University who's doing something very similar to that. There are projects that we can undertake. I was visiting a children's hospital where they have set up an array of solar panels, and they've done it in conjunction with the high school nearby. So it was a science project for the students. At the same time, it's now benefiting the whole community to have access to more energy.
So how do you, some of the things are relatively, I mean, nothing is easy, but some things are easier than others, right? Changing light bulbs, buying electric vehicles as your fleet gets replaced, things like that. Composting. I mean, just think of how much food is thrown out. I mean, think of all the meals that a healthcare system does in a day, and a lot of it is garbage. So some of these things are not easy, but easier. How much do we know about, I mean, intuitively, but my intuition isn't always right. Intuitively, it seems like there's ROI, that if you make these changes, you should. Can you make that case to health sectors? Or people say it's expensive to change this. It's hard to do this. Our margins aren't great. We're still recovering from the pandemic. How much can you reassure them, or how much do we know about? Yes, this is not just a moral and healthcare issue. This makes financial good sense.
Actually, it doesn't take long, because take a look at the financials of any facility, and you'll see that one of their expenses that continues to grow is disposal of waste. And so they get it. Their costs continue to rise in this sector, and they've got to do something about it. When they see someone pitching an idea that maybe even provides them with some money to do what they know they're going to have to do anyhow to save money in their bottom line, it's a great marriage. And so I think we're getting there. But I do want to give credit to the healthcare sector. They recognize that you can't pitch good health and then be creating a whole bunch of waste at the same time.
So I mean, it seemed the reporting I've done, I mean, there's early adopters. There are people who are enthusiastically embracing this, but there are a lot who aren't doing a lot, or they're doing sort of the easier things, like, recycling, do a better job recycling. And given the amount of waste, that's important. It's not minor. But, what are you seeing in terms of how do you get to the critical mass? Because the healthcare sector is not yet at a critical mass.
Yeah, so it's not surprising that I mentioned that one of the facilities, one of the hospitals that took us up on our offer was in Boston, Massachusetts, where you've got such a large healthcare sector, very profitable healthcare sector. Don't be surprised if it takes us a while to get into rural hospitals and get them to buy in, or the hospitals that are caring for the most disadvantaged, who are always on the margin. You're going to look at your bottom line at the end of the day. What we hope is what we can do is encourage, with some support financially, but good ideas, we can encourage the sector to get there. And quite honestly, the sector has to help take care of itself. It can't just be that if you're financially well-heeled, you get to move quickly and leave everybody else behind. It's got to be a sector movement, and I think there is sector support. It's just making it, connecting the dots faster for them. Shouldn't take them the decades it took me to connect the dots. They should connect the dots sooner, that it's in their interest to do this right. Because at some point, if they continue to be close to 10% of the problem, they're going to start paying 10% of the price. When
you talk to physicians and hospital administrators or nurses or whoever you come in contact with, does this come up spontaneously? I mean, when they come to HHS, they care about their payment and the perpetual Medicare payment wars, et cetera. How much does it bubble up from not you going to them, but how much is it sort of like, let us show you our I don't know if they want you to see the compost pile, but show us share what we're doing. Here's how we're using there, because I think some hospitals don't even understand what's available and the resource. If you go into the HHS website, there's all these webinars and toolkits, and there's lots of things that the office has put out over the last year or so to make it how-tos, and the money that goes with the how-tos. But how much in the 3 years you've been in office, how much is that changing?
Honestly, the folks that most people encounter in a hospital or a medical facility are not going to say to you, by the way, after we take your blood pressure, I want to tell you about everything we're doing to reduce the carbon footprint in our facility.
But when they talk to you?
Even me. the hospital administrator, the folks who are responsible for coming up with the innovation, they're into it. They recognize and by the way, because this is a sector that hasn't really been early into making these kinds of investments, when they do, it's a pretty big deal. It's almost like Christmas for them, because they're giving gifts. They're really doing something good, and they can show it. But does the internist that you encounter start talking about the carbon footprint? Not yet. Not yet.
We are also living in an era of, incredible political partisanship. We're very red-blue. You haven't been able to get funding for everything you want to do in this area. You're moving people around and figuring out how to make things happen, but without the resources you have sought. And yet, the climate, the planet isn't divided into red and blue. People who get sick are not divided into red and blue. So, is there a way, you mentioned rural America, which tends to be more in disproportionately conservative states. Is there a way that you have been able to talk across the aisle on this issue, in that it is so hard to break through the partisanship on anything right now, right? I mean, that's your life, right? And you've seen it get worse in your years here. But this shouldn't be. So, I mean, do you have any allies on the other side? Do you have people who are understanding that, this is really existential and healthcare is part of it? So
if you go beyond our borders, if you speak of this issue on global terms, it's not really red, blue. It's not really political. It's have not, more than anything else. We have capacity. Even rural America facilities have capacity compared to most of the developing world. And so the issue really isn't so much the politics of climate change, it's the politics of financial capability. And what you find is that most places around the world are barely trying to keep their places sanitary, let alone reduce their carbon footprint. And so that's both tough, but also exciting, because that means it doesn't take a lot for us to introduce these ways to be cleaner without them having to incur the cost of having to undo everything they did to move forward. And so if we're smart, we will, as we always do, begin to share our technology and our know-how with the developing world. So they won't go through the process of developing a facility that only uses a coal alternative plant when their electricity goes down. And they have to generate, have to use generators to fire up and get more electricity. They'll figure out, the solar panels that they can use. We'll be there with them to help out. And so the good thing is it's not political in most cases. And quite honestly, even in the U.S., you talk to a rural health facility, they would love nothing more than to save money on their waste budget. It's just that they're having such a hard time just meeting their budget needs on the beds that they have for patients, that they don't have the kind of bandwidth to think about that. And so that requires the Boston, Massachusetts, the Los Angeles, California, the New York cities, the San Francisco, Californias, to step up those facilities in those places that have the large academic health centers to step up and say, this is how we do it. Let's share this know-how. And to some degree, let's share some of that wealth to get everyone to come up. So all boats will get lifted.
What about the, I know that one of that you can't mandate, but you can partner with people who can help create this momentum. And one of the important partners is the Joint Commission, for which is the organization that accredits hospitals. Yes. And they've come up with a voluntary system that health systems can get a Joint Commission certification for sustainability. So that gives you something. They care about their accreditation. It's not just status, it's sort of meaningful within the healthcare world, and that's an important partner going forward. I'm sure that you will tell me that you are quite confident that President Biden will be reelected, but well,
I'm glad you said it, and I didn't have to say it. So,
But in the hypothetical possibility that we have a different White House in a year, this is unlikely. Healthcare and climate is unlikely, or reducing the carbon of the carbon footprint of the sector is unlikely to, speaking hypothetically again, unlikely to be a priority. So, in the year that you have, or the 10 months you have, what else can you do to make this maybe not irreversible, but to just get people on board, make that this train is going, not talking about going. So what else are you? I'm not seeing, when I write about it, I am seeing a lot more activity in the liberal states, in the Democratic states. It's not zero in more conservative states, but there's an imbalance. So how do you make this? I don't want to make a pun about, but how do you make it sustainable? How do you make sustainability sustainable?
There has to be will, because there isn't law in place to require this at the speed we need it. And so you have to continue to cultivate the will to get there. We'll get there just as we always do, because economics requires folks to get there. At some point, the price will become too unbearable to not be clean. But I don't think any of us wants to wait till we get to that point. And I don't believe any of these facilities and providers, healthcare providers, want to wait till we get to that point. It's just, it's always tough to be the first one to take the leap, because it could be expensive. You don't know where you're going to go. Who knows who's going to come with you. But once people start taking the jump into that water and they find they can swim, more will come. And It has to come sooner. What we're doing is, I hope, incentivizing that process to move faster. Wish we had more money to incentivize it even more. But what we are doing is putting in place some infrastructure, because we're creating these partnerships. We're making sector components are making investments, commitments to move in this direction. Because once you do that, once you start building that array of solar panels, you're stuck. You got to keep going because you've already expended money, rather than go towards some kind of coal-fired alternative. And so there are things that we can do that move this forward. It's just moving at the pace of the will versus the pace of law.
Yeah, one thing I learned recently, it's not HHS, it's energy and EPA, but like I think we all think of Energy Star as like, something on our refrigerator, the blue label on our refrigerator, but there's this whole Energy Star thing for hospitals that are how to really redesign. It's not HHS, but I'm sure you work with them, because it helps. I mean, hospitals use an awful lot of energy. I didn't know until recently you couldn't turn off an MRI. Like you have to, these things are always on. You can be smarter about how, when you can power things down, but that's a government-wide thing, not HHS. You sort of mentioned this, but this is what I want to sort of end up with. This was the first time in December, this was the first time that the International Climate Conference had a health day. And the US did send a delegation. Admiral Levine went. What did that we've been having climate conferences for a couple of decades now, but there was this international recognition that a time was set apart and declared the health day. I don't know if you helped make that happen, but what is the significance that climate health link, that climate decarbonizing health link? It is a problem around the world. It's a bigger problem here in terms of how much carbon and how much waste, just because we're really good at waste. But that was different. So talk about why it was important that it was different. And then I know you have a tight schedule on Earth Day, and we're going to let you go. But like the global optimism we can end up, because there's a lot of work to do.
So the good thing is that around the world, people get it. They have the same issue in other countries that we have, and that is making enough of an investment. But the world gets it. You can see it. As they say, you can go up on one of those satellites, and when you take those images and shoot them back home, you can see the damage we're doing to Mother Earth. And so people get it. Here's the important point I want to make about the international community and international work on climate and global cleanup. The world wants to know if we're really in this for good, if we're serious about coming back in, because we left. We left so many of the international fora when it came to not just climate, but health. And we were AWOL for a while, and people got accustomed actually to us not being around, not being present, which is tough because typically we're the gorilla in the room, and they got accustomed to it. Now that we're back, and President Biden made it clear we are back with a vengeance because we can't afford to be gone, you can see in the back of people's minds, are you sticking around? And that's the worst part, because if they don't know if we're sticking around, it's harder for them to make commitments, because always the U.S. was there to make a commitment, and always our commitment was the biggest, and it was the anchor that made everybody else say, okay, I'm in too. I'll jump in that water. When we were no longer jumping in the water, everyone went back from the edge and didn't want to jump in the water. So the most important thing I can tell you is, regardless of who's at the helm at the White House, we have to continue jumping in the water, because that's the only way you get to the rest of the world to really make that commitment. And I think more and more our health facilities, our health sector is recognizing that we probably are collectively the largest power plant in the nation. Because each one of those hospitals is essentially a power plant, their own little separate mini power plant. And when you add them all up, it makes one major collective power plant. And we have an obligation to show how we can use our technology to show the rest of the world when you jump in that water, you'll be able to swim. And so the most important thing I could tell you about anything dealing with global international affairs is, we just got to be ready to jump and stay in the water.
Okay. Well, thank you very much for joining us, and the water's getting hotter, so.
Thank you. Thank you very much.